Well, we all want to look our best, right? Well, it used to be in the old days where you'd have to go under the scalpel to look that way and to look as rejuvenated as you could. Well, with me today is cosmetic laser physician Dr. Matta. Welcome to the show.
Thank you for having me.
Now, you actually produce wonderful effects simply by doing what? Without going under a scalpel?
Well, we do all non-surgical.
Okay.
So nowadays, more people are trying to do things without having, significantly invasive procedures.
Okay.
And the soft lift is a fantastic treatment which uses Botox and Juvederm to improve wrinkles and to add facial volume, so to help restore cheeks, to improve what we call the smile lines, nasolabial folds, lip augmentation, chin augmentation, temple augmentation. You basically have a blank canvas. You can have a lot of fun and create and have a nice sculptured effect.
So you call it a soft lift?
Yes.
And so what exactly are you doing? So for Botox, I know Botox works well for wrinkles.
Yes, I mean Botox is now a household word. Everybody knows Botox. It's
Right.
as popular as cornflakes. And
it's more expensive than cornflakes.
The most common areas for Botox are the frown lines, so you don't look so angry.
So you don't look angry.
And the smile lines, the crow's feet. And you can use it other places as well. They are considered off-label, so they're not officially approved by Health Canada to be used in that area, but we've been using it for about 30 years, and we know they're safe. So that would include areas like the chin for dimpling, or the lower muscles here to prevent the downward turning of the mouth, or to help improve necklace bands in the neck. So those are all off-label indications, but they work beautifully.
So you're saying by injecting here, you get a lift?
Yeah. Yeah, because these muscles get stronger as we age, and they pull down the corners of the mouth, and they push up the chin, and they create that dimpling and that line around this area. It's a great name called the mental crease. And just with some Botox, you can get rid of that.
Now, Botox also works on like sweating. I've heard people using it for sweating.
Yeah, we do a lot. I actually do it personally. And it is the only drug that is officially approved for what we call hyperhidrosis, which affects about 1% of Canadians. So it's covered by insurance companies. It's officially indicated. The average is about a 7-month duration of effect, and it works absolutely beautiful, 90% plus reduction in sweating. And we do it in even teenagers, 12-year-old, 13-year-olds. It's completely safe.
Wow. So if I'll go to my insurance company and say, I'm sweating from my eyes.
I think they'll look into that one, but I'm not sure.
My eyes are sweating. Now we have some pictures, I think, if we can just take a look at those.
Okay. So this is before. I mean, it never really shows up fully on a photo. It's much clearer when you look in the mirror, and people say, "Oh my God, you look so much more refreshed. You look less tired," and that's the most common thing. I mean, people don't want to look tired. This is the after.
So that's the same. Oh,
so that's the same individual.
She just looks like
she looks rested,
lifted.
relaxed, and my premise is look fabulous, not fake. We don't like people to look fake.
Wow, that's incredible, incredible.
Yeah.
Now you also add volume to the face, because as we get older, we lose volume in our face, right?
Yes, the 3Ds, descent, deterioration, and deflation. So the cheeks that were once up here decide to make their way down here.
Right.
So we restore them, and that's actually common on men and women, not just women.
Oh, absolutely.
Yeah, men generally age by a loss of facial volume in the front.
Okay.
Women lose it in the side, and they get that jowling. So by augmenting this area and bringing this up, the jowl softens, the face just looks more youthful.
Oh, wow. Fantastic.
Yeah. And that's Juvederm. That's the part of the soft lift.
And does that hurt? Is that a painful procedure?
No, you know what? That's actually a great question, because a lot of people are going to say, oh, I don't want to do it because it's going to hurt. It's got built-in anesthetic nowadays, and it's relatively painless.
Wow.
Yeah.
Wow. Now, you also, you brought this strange-looking machine.
Yes, it is called the Body Tight Effects.
And you brought Linda with you.
And we brought Linda. And Linda basically is my boss. She runs the office.
Okay.
And as such, she also gets to be the human guinea pig whenever we try something new.
Oh, terrific.
So Linda,
wow, you look great. I mean,
Thank you.
I don't know if you want to zoom in a little bit on Linda. Linda is also the recipient of a soft lift.
Okay.
And
yeah, your skin is so clear and like beautiful. Yeah,
and Linda is 51 years old.
Wow.
And
you look like 35, honestly.
Thank you.
Yeah.
Well, she represents our goal and our aim at the clinic, right?
Okay.
To look great. She's a mom. 99% of our patients are just typical average moms, not the celebrities, not the ones that want the over-the-top look. They don't want to, everybody around their family to say, what did you do? What did you do?
You don't want to look fake. You don't want to look fake.
So
well, you don't. You look beautiful. Really beautiful.
So
Now, talk to us about
this machine. Is a combination treatment for fat, reduction, skin tightening, and cellulite reduction.
Wow.
Yeah,
okay.
so it's a wonderful machine. And
Can I take it home with me?
of course. We rent it out by the day, Glenn. Not a problem.
So what does this do? Okay,
so this is a radio frequency handpiece.
Okay.
And the energy is transmitted between these two electrodes, basically, you can think of it. And it actually sucks up the skin.
Okay.
And then it heats up the tissue.
Yeah.
And then when it reaches a target temperature, it sends out a pulse, which actually destroys fat cells. It kills the fat cells permanently.
Wow.
Yeah, and it is almost brand new in Canada.
Is this through working out, or like you have a great body? So
Thank you.
Yeah.
Thank you. No, I've been pretty lazy lately, so
this is your magic weapon?
Yeah, oh yeah, this is my new best friend.
So we use this both for cellulite. It actually, we are going to be looking at it for stretch marks as well, because Linda still does have some stretch marks from 2 children. And this is fantastic for mummy tummy, where you get that loose skin after pregnancy. You get the little bit of fat that's still there, and that little hang that just goes over the pants that drives women crazy, and they don't want to go for a tummy tuck.
Okay,
so
I
it's
have
a very
mummy tummy too,
it's a very simple
big meal.
procedure, and you know, the handpiece is placed on the abdomen, and then you can hear it heating up. And then when it reaches a target temperature, we're just going to do it in one little area to give you an idea. It gives you an idea here. We're already at 32 degrees.
And then it goes up. What's the target temperature?
The target temperature usually is around 40 degrees Celsius or 42 or 43 degrees Celsius. And that allows us to break down the fat.
We've only got about a minute left.
Okay.
So Linda, does that hurt at all? No?
No, you just feel a slight suction and a very slight warming. It's
So you
quite
hear
tolerable.
you hear it speeding up?
Yeah.
Okay. And it's just about to send off that pulse. And
wow.
and then it heats it up.
Incredible. Well, thank you very much.
You are
Thank
very
you
welcome.
much. Like, great information. So you don't have to go into the scalpel to get pretty. But for more information, go to drmetta.com. Now, here's our volunteer, Joseph Ballant, with some community events that's happening around the city.